Hello, my name is Victoria Duran, and today I will be talking about hallucinogens. I will explain what they are, their effects on the mind, their physical effects, the risks associated with taking them, as well as the addiction and abuse potential. So what are hallucinogens? Hallucinogens, also known as psychedelics, are substances that temporarily alter perception and mood. Hallucinogens have been used throughout history for religious and traditional practices and occur naturally in plants and fungi, but can also be synthetically produced. Hallucinogens come in various different forms, including MDMA and ecstasy, LSD, mescaline, also known as peyote, as well as psilocybin, also known as mushrooms. Here are a couple more examples of the different forms that hallucinogenic drugs come in, as well as their effects. So hallucinogens can affect the mind, but it is important to note that these effects do vary based on the amount taken and potency, the individual's biology, age, and sex, their personality, mood, mindset, and the environment that they are in. It is also important to know that hallucinogenic drugs are often cut with other fillers that can produce effects that aren't usually associated with hallucinogenic drugs. Users can experience some or all of these stages of sensory experiences: heightened senses, loss of control, loss of identity or self-reflection, illusions and hallucinations, altered perception of time and distance. In some cases, these sensory effects can have extreme reactions that include increased body temperature, electrolyte imbalances, cardiac arrest, nightmare-like senses of reality, which we would call a bad trip, and it can also lead the individual to be unable to feel pain, direct their movement, or remember. Users may develop hallucinogenic persisting perception disorder, HPPD, which is when an individual experiences moments of perceptual distortion after a significant period of time has passed since taking the drug. This can be weeks, years, months. It is very uncommon and unpredictable. So not only can hallucinogenic drugs affect the mind, but they do have effects on the body as well. They include elevated heart rate, increased blood pressure, dilated pupils, vomiting and nausea, extreme happiness, extreme fear, and anxiety. While hallucinogens do have adverse health effects, fatal overdoses from hallucinogens are rare and usually only happen when combined with other drugs. Most deaths that are correlated to hallucinogenic use are due to suicide, accidents, dangerous behavior, or mistakenly eating a poisonous plant. So, for example, someone might mistake a poisonous cactus for the peyote cactus. One of the risks associated with hallucinogenic use is contamination. It is very common for illegally manufactured drugs to be cut with fillers, one of these major fillers being fentanyl, which can have detrimental effects, including overdose and death. Hallucinogenic drugs can also interact with other drugs or medications an individual has taken and can likely cause serotonin syndrome. This is when there is an increased amount of serotonin levels in the brain. These symptoms are usually mild, but in rare cases can cause death. The hallucinogenic use of drugs has been linked to dangerous behavior and injuries. Because of the impaired thought process and perceptions of these drugs, individuals behave in more dangerous manners. This has been shown to lead to injuries as well as other safety issues. In a survey of approximately 2,000 people who took psilocybin, outside of a medical setting, 11% of them reported that they put themselves or others at risk of harm. While hallucinogens are not considered to be addictive and don't produce withdrawal symptoms, they have been found to cause psychological dependence. Because of the euphoric feeling caused by them, it is common for individuals to feel that they can't enjoy life without it. The psychological dependence usually leads to a built-up tolerance, causing users to take more of the drug, then creating a cycle without withdrawal symptoms. Hallucinogenic abuse is mostly found in young adults, as well as junior and senior high school-aged individuals. And that is all. Thank you so much for listening.